Hi everyone. So yesterday I released the results for the essays. So I thought I'd just do this quick little video to give you some more general feedback on the essays and also some things to think about in the lead up to your reflective task. So each of you should by now have hopefully had a look at the feedback that we have provided. So what the facilitators have done in the marking of these is actually use that detailed marking rubric. So if you go into your submission in LMS, you should be able to see a breakdown of each criteria and the mark that you've been given for each of those with an explanation of why you've got that particular mark. In addition to that, facilitators have provided some comments on your work. That will vary from facilitator to facilitator. It wasn't a requirement that facilitators provide that because we do have a rubric. However, I know that each of them have given you some additional comments. So please take the time to just go through those, go back over the instructions for the assignment, go back through your essay and look at the comments that have been provided and on the things that you've done well, but also the areas that you might need to improve on. I would really like to say a big thank you to everyone who submitted the essay. The quality of these essays was really well done, and I think that that's reflected in the overall marks that I see across the entire subject. So when I looked at the breakdown of marks, the average mark for this assessment in this subject was a 69, which is a high C. So that's really, really outstanding. So thank you. When I did some calculations yesterday looking at the marks, I saw that just over 50% of the class got a B or higher. So again, the quality of what we were reading was really outstanding and really is a credit to you. And of course, it makes our job so much easier and certainly much more enjoyable. And in fact, there were some truly outstanding essays that we read. And I think that one of the things that I noticed in many of the essays that I marked, that even if some of the content perhaps wasn't quite spot on, the actual structure and the writing was still really well done, and students were still getting good marks for those two criteria. So one of the sections that we noticed this semester that was done consistently well across the subject were your introductions. Introductions can be really tricky to write, but what we saw consistently across the subject were really good, clear introductions where you had defined or were able to explain remoteness. You were able to bring in some discussion around the classification system. You identified your remote community and positioned that within that classification system, and then made some comment around things like the health issues, the determinants, and the health promotion initiative that you would be looking at. So it was really clear that people had thought about the structure of their essay because that's actually reflected in the introduction. As I say, what we saw was that most of you were really able to explain the concept of remoteness and remote communities that were appropriately selected. There were some students who, did select an RA5 community as opposed to an RA4, which was not necessarily a problem, provided that you acknowledged that it was actually a very remote community. Some students did, however, use the incorrect classification system for remoteness. So what we saw were students referring to ARIA without linking that to the ASGS, or we saw students referring to the ASGC, which is the older version of the ASGS, which is the current system. The other thing that we saw throughout most of the essays was that the structure of the body was really quite well done. So it was again obvious that most of you had followed the structure that was provided within the instructions of the assignment, or you'd actually looked at the example assessments and used those to actually help you frame up this. So really thank you and well done. And I'm hoping that we can see similar quality in your reflective pieces at the end of semester. Some of the things that were perhaps done not quite as well were things like the health issues were not necessarily explained with relevance to the region. So there might have been some identification of health issues. However, more general comments were made about these in relation to rural and remote communities, with little or no locally relevant data provided as evidence that these were in existence in the community in focus. And remember that this essay was an essay, but also a case study. So that meant that throughout the essay, you needed to be drawing on as much locally relevant data as possible in relation to the characteristics of that community, the health issues within that community, and also the determinants of health as well. And in communities like Alice Springs, which was a very popular choice and a good choice too, there is a lot of really good locally relevant health data that's available. The primary health networks have a really comprehensive community profile on communities like Alice Springs. Of course, there are some remote communities where that's not as readily available, but there are still ways to access that particular information. Many of you looked at Indigenous people and health issues and did actually quite a good job of that. I saw very little in terms of victim blaming, which was really pleasing to see. But there were just some statements which just didn't quite fit with the analysis. And again, these are things that you would perhaps pick up on through proofreading your work. So we saw some just comments like, using Indigenous Australians versus Australians as opposed to Indigenous and non-Indigenous Australians. Just making sure when you're writing essays like this where you're having to present the data on particular population groups that you just go back and make sure that you're interpreting that correctly. So for example, 68% of babies don't live beyond, Indigenous babies don't live beyond the age of 5. We know that that's not correct. So those are just some things that you can, go back and proofread your work and you'd pick up on those pretty easily. The other thing, the area that perhaps we didn't see, what perhaps wasn't as strong as other sections of the essays, was sometimes the choice of the health promotion initiative. So we did see that there was often an inappropriate choice. So people were looking, for example, at a service rather than a health promotion initiative, which would typically be a program or a policy or some sort of, population health plan, for example, or a public health and wellbeing plan. So sometimes we were seeing people looking at actual services, which is not health promotion. Or what we saw was that there was a really good choice of the initiative, but it just wasn't very well linked to the health issues and or the determinants that people had presented in their discussions. So that would be my only comments around the health promotion initiative. There were some really great choices. And lots of students did link it very well to their discussion, but there were some who, despite having picked really good examples of health promotion, just hadn't quite made that connection. And so you're much more likely to get a 6 out of 10 for that particular criteria, as opposed to a 7, 8, 9 or 10 if you had linked it really well and it was relevant to the rest of your discussion. Just some areas for improvement or some things to work on and to think about in the lead up to the reflective task. The referencing is one area that some of you still need to really work on. We know that there's a large proportion of first year students in this subject, and so the referencing is something that you're still learning, and we understand that, and so we've tried to provide you with feedback around what to do to improve that. But you do need to make sure that you are following the APA 6 guidelines. When an assessment says you must use APA 6, then you must use APA 6. And if you're using anything else, then you're not following the instruction, then you're not meeting the criteria, and therefore you're not going to do as well. in terms of marks. There is the library referencing tool. Please use that. That's what we use to double check the marking. So for me, when I'm marking, I'll have your assignment up, I'll have the library referencing tool up, and if there's something that I'm not sure about, I'll actually go back to that tool myself and just double check the referencing. So you should be using it as you're actually going about the writing and the referencing of your work. There were a number of students who used EndNote, which is fine. However, you need to understand the formatting and how to do referencing manually in order to pick up errors in the style in EndNote, because EndNote doesn't always reference this, use the referencing style correctly, because it depends on how you have entered in the references. So you do need to just go back and check that, one, you understand the basic principles and the style of the referencing system required, but also that you've entered in your references correctly, so that you know what to look for if you are going to use EndNote. As I've mentioned before, proofreading your work, we did see many typographical and grammatical errors throughout lots of the essays, and these are all things that could be easily avoided if you just spend 5 or 10 minutes just going through your work at the end and just proofreading it, or giving it to somebody else just to have a look at, just for those typos and grammatical errors. There's really easy marks to be had in both referencing and the writing if you follow the APA guidelines and if you proofread your work. If you're not getting full marks for those, you're really giving away some easy marks. And the other thing that I would just say is to really, if the academic writing is not your strong point, or the referencing is not your strong point, there are people out there who can actually help you with this. So really make sure that you make the most of the peer learning advisors and the LTLTs, or the La Trobe Teaching and Learning Advisors, who are located in the libraries on each campus. So for example, if you're struggling with referencing, you can actually take your reference list into them, and they will help you to go through the formatting of it to make sure that you've actually got the style correct. They can help you with things like structure and making a plan. These are often students who have done these assessments in the past, so they're familiar with them. In this subject, I've used the peer learning advisors to help me to actually develop the marking rubrics. So they've had a lot of input into the explanations that go into each of the criteria, so that these are written from the perspective of the student and in a way that a student is going to understand. And the benefit of having the peer learning advisors involved in the development of those rubrics means that they're skilled in being able to then explain the assessments to students who might come in looking for support. So really make use of those. If you're what we might consider an at-risk student, so somebody who perhaps hasn't passed the assessment and is really struggling, we can also do a one-on-one referral to one of the learning advisors, and you can meet with them and have some one-on-one time, and they'll help you with your academic skills. If you think that you may be one of those at-risk students, please don't hesitate to get in touch with me, and we can discuss whether we think that this might be a suitable option for you, or we can have a conversation around what other supports might be available to you. So that's all I really want to say about the essays. Again, thank you to everyone who submitted this. Really, it was actually really easy to mark these, and as I say, the quality was really high for this semester in this subject. So thank you. I will be doing a Zoom session next week, so in week 10 on the Thursday. The dates are in the LMS. In that Zoom session, I'll be talking about the reflective piece. I'll go through the instructions and the marking rubric, and I'll also go through some examples of both parts of that particular assignment. So it'd be great if people could log on to that that live, and at least have done some prep and have a think about what you want to focus on in your reflection. There'll be opportunities to ask questions, and if you can't make it, please don't worry, because it will be recorded, and I will pop that recording up on LMS. So I'm hoping that you're enjoying your what little time off you get this week, and I do hope that you are having a little bit of downtime, and I will see you all on LMS starting from next Monday. Thanks, everyone.